Well, before we get into measuring blood pressure, first we need to understand the physiology and mechanism behind taking blood pressure. The principle of measuring blood pressure manually is that we place the blood pressure cuff on the patient's arm above the elbow and then gently inflate it using the hand pump until the pressure inside the cuff exceeds the pressure in the artery, which is the brachial artery. At this point, the blood flow in the vessel stops. Then we slowly release the pressure in the cuff, and when the pressure inside the cuff drops below the arterial pressure, the vessel opens again and blood flow resumes. So, what is the mechanism of measuring blood pressure? To fully understand this important concept better, we first need to know a few fundamental principles. Normally, the blood flowing through our intricate vessels moves in a very specific laminar fashion, meaning the blood flows in distinct layers and perfectly concentric circles within the vessel, steadily moving forward toward the sides. This smooth, undisturbed laminar flow does not produce any audible sound, just like a wide river flowing smoothly and quietly across a flat, expansive plain without any obstacles or significant narrowing in its path. It moves silently and makes absolutely no noise whatsoever. So the crucial question is, when exactly does blood flow become audible? When there is a narrowing in the path of the blood flow, it causes the previously mentioned laminar flow to turn into turbulent flow. In other words, turbulence occurs, and instead of the blood moving in smooth, layered, and concentric circles, each part of the flow moves in a different direction, resulting in turbulence. So, when does blood flow become turbulent? As we mentioned, whenever the vessel pathway is not smooth, that is when there is a narrowing or an obstruction inside the vessel. In this situation, the order of the laminar layers is lost, and these layers of blood flow move in different directions. In other words, they become turbulent, and it's this turbulence that causes the sound to be produced. Exactly like that river, which passes through a narrow passage or flows through a mountainous valley full of rocks and narrow sections. Well, this causes the flow of this causes the flow of water to become turbulent, meaning it becomes turbulent and chaotic. And this turbulence and chaotic movement of the water as it passes through those narrow passages and rocks leads to the creation of a lot of noise, so much so that even from several hundred meters or even a few kilometers away, we can hear the sound of that river because of the turbulence present. The same mechanism is used for measuring blood pressure as well. When the vessel is completely open, the blood flow is laminar and moves in layers, so no sound is produced. It's a very smooth laminar flow with no noise at all. And when the vessel is completely closed, 100% blocked, again, no sound is produced. Why? Because no blood is flowing through it to create any sound. But if the vessel is narrowed, then sound is produced. And the greater the degree of narrowing, the more turbulent the blood flow will be, and the louder and more pronounced the sound it creates. So, what does this have to do with the sphygmomanometer device? The connection with the sphygmomanometer is like this. Before we put the cuff on and inflate it, our vessel is completely open, 100% open, so no sound is produced and we don't hear anything. After we inflate the cuff and completely close off the vessel, again, there is no sound because blood flow is 100% blocked and no blood passes through the vessel. But when we start to slowly deflate the cuff and the pressure inside the cuff drops below the arterial pressure, the artery opens up again. But at first, it opens just a little, say, only 10% of the vessel's cross section. In other words, we've created a 90% narrowing, and this narrowing in the artery causes turbulent blood flow, which produces a sound. This sound is what we call the Korotkoff sound. So the Korotkoff sound is the first sound we hear immediately after the vessel reopens. Due to the blood rushing through that severe narrowing, the more we deflate the cuff, the less external narrowing we apply to the vessel, meaning the vessel opens up more, which reduces the turbulence and the sound becomes quieter until the vessel is completely open and the sound disappears. When the vessel is fully open and there's no more external pressure, we no longer hear the Korotkoff sound. This point is what we call the diastolic blood pressure. Let's use an analogy to make this clearer. Imagine a garden hose. Normally, water flows through it and you barely feel any vibration. If you step on the hose, you're applying external pressure and creating a narrowing in the water's path, which causes some turbulence. You can feel this turbulence and vibration under your foot. Or if you pinch and bend the hose, you're again creating a narrowing in the water's path, which leads to turbulence. The more you bend the hose, the greater the narrowing, the more turbulence, and the louder the sound until you completely close off the hose. Then no water flows and you hear nothing. The pressure at which the Korotkoff sound is first heard is called the systolic blood pressure, and the pressure at which the Korotkoff sound disappears is the diastolic blood pressure. In a normal person, systolic blood pressure is 120 millimeters of mercury and diastolic is 80 millimeters of mercury. So, when the cuff pressure reaches 120 millimeters of mercury, blood flow in the brachial artery resumes, passing through the narrowing we've created, and the first Korotkoff sound is heard. When the narrowing is completely gone and the vessel is 100% open, we no longer hear the Korotkoff sound, and that number, 80 millimeters of mercury, is our diastolic pressure. Now, who is Korotkoff? Who is Korotkoff? Nikolai Korotkoff was a Russian physician and scientist who, about 120 years ago, in the year 1900, was the first to discover this mechanism. Since hearing these Korotkoff sounds with a regular stethoscope is difficult, we use a medical stethoscope to listen to these sounds. The stethoscope should be placed exactly with its diaphragm side on the brachial artery, and then we listen for these sounds. The more carefully we follow the correct principles when measuring blood pressure, the more accurate our measurement will be.